The Office of the National Coordinator for Health Information Technology welcomes you to today's presentation of the Leading Edge Acceleration Project, also known as LEAP, in Health Information Technology. Today is Tuesday, June 28th, 2022, and this is an information session for the LEAP Notice of Funding Opportunity, also known as NOFO. Today's agenda will include an introduction of speakers, housekeeping, notice of funding opportunity, background information on the LEAP program, funding eligibility and application information, as well as application responsiveness and merit review criteria. Today's speakers will include myself, Yolanda Thompson, Grants Management Specialist and Merit Review Coordinator for the Office of Procurement and Grants and ONC. Wei Chang, the Public Health Analyst for ONC's Technical Strategy and Analysis Division. Stephanie Garcia, Scientific Advancement Branch Chief for ONC's Technical Strategy and Analysis Division. And Jewel Love, who will be your moderator from the Office of Procurement and Grants. I will now turn it over to Jewel Love to moderate today's LEAP information session.
Thank you, Yolanda. Let's start with our housekeeping. This webinar is being recorded and will be made publicly available. All phone lines will be muted during the presentation. If you have questions, please enter them into the chat box. All questions will be answered in FAQs made publicly available weekly. Webinar and FAQs will be available at the link on the screen. How to ask a question. If you have any questions during the presentation, please follow the instructions below. Use the chat function to ask your question. Along the bottom of the webinar window, find and click the chat button. Input your question in the chat box, press enter or return to send. Additional questions. If you have additional questions after today's webinar session, please direct them to the following email address, onc-leap@hhs.gov. It's also on your screen. I'll now turn it over to Wei Chang.
So thank you everyone for tuning in to learn more about the Notice of Funding Opportunity for LEAP in Health IT. Next slide, please. Great. So for this Notice of Funding Opportunity, there will be 2 areas of interest, and you will hear more about each of them today. We intend to make 1 award per area of interest and up to $1 million per award. The period of performance is 2 years, and in the proposal, you may propose up to 5 years. Applicants are encouraged to submit your applications based on the 5-year budget period, and additional funding for years 3 through 5 may be provided, contingent upon availability of funds, meaningful progress, and ONC priorities. And the letters of intent are due by June 30th, 2022, and the applications will be due by August 15th. Next slide, please. And for this Notice of Funding Opportunity, there will be 2 areas of interest. The first area of interest will be address health equity and social determinants of health, SDOH, through innovative open source technology tools and electronic health records. The second area of interest will be to demonstrate the use of equity-enhancing patient-generated health data, or PGHD, for clinical care and research. And this is an important note to please clearly indicate which area of interest you are applying for. And we ask you to focus on one and not both. Application packages addressing more than one area of interest will not be considered for an award. So the first area of interest is address health equity and social determinants of health, or SDOH, through innovative open source technology tools and electronic health records. There will be one award of up to $1 million. The primary goal for this area of interest is to advance the adoption and use of SDOH-related standards and data in underserved populations to address disparities and to identify the challenges and opportunities inherent in scaling health IT solutions across communities. The key objectives for this area of interest are the following. One is to create specific use cases for the technology platform based on high-risk population factors like chronic diseases, which may include but are not limited to heart disease, hypertension, and cancer, and or social risk factors, which may include but are not limited to housing instability, food insecurity, and transportation insecurity in underserved communities. While creating the use cases, the applicant must use standardized SDOH data collected within the EHR. Another objective is to create and implement non-proprietary technical solutions for referring patients to community-based organizations, or CBOs, that interface seamlessly with the health system or community health center's EHR. Also, to create and implement technology that supports patient engagement and at a minimum allows patients to manage their data by suggesting edits to their SDOH data and provide consent and authorization to use sensitive data. To coordinate forms, to share implementation strategies, lessons learned, and recommendations with other healthcare providers and CBOs. Forms may include, but are not limited to, workshops, webinars, and documents. So for area of interest 1, there are 2 applicant-required expertise. One is data standards development and balloting. The other is API development and EHR integration. Other requirements for this area of interest include to be considered for an award, applicant's proposal should include a collaborative team of key stakeholders who will be directly involved in the project, which we refer to as the coalition. And the applicant's proposal shall not rely on proprietary technology for apps or web portals. The proposed technical solution for this area of interest should leverage previous work funded by ONC, such as the ONC LEAD projects, the Gravity project, 360X, and not duplicate efforts. Now I will turn it over to Stephanie Garcia to talk about area of interest 2.
Thank you, Wei. For area of interest 2, ONC is looking for proposals that will demonstrate the use of equity-enhancing patient-generated health data, or PGHD, to support both clinical care and research. there is one award available for up to $1 million. The goal is to use a standards-based approach to develop PGHD technology that can be scaled and is in direct support of enhancing the ability to make PGHD data available for clinical care and research. The proposed technology can include software apps, remote monitoring devices, or wearable technology that collect data outside of the clinical care setting. Next slide, please. Here is the list of key objectives for Area of Interest number 2. Awardees will perform a landscape analysis or environmental scan to understand the current standards and interoperability of PGHD technologies related to the proposed PGHD technology solution, such as capabilities across device manufacturers and different EHRs. Identify at least 2 separate healthcare locations and at least 2 use cases that support making data available for clinical care and research, that incorporate PGHD and that support the needs of underserved communities. Create and develop plans for at least 2 demonstration projects with consideration on reuse and scalability of the proposed PGHD technology solution. 2, result in 2 demonstration projects. The proposed PGHD technology solution should be implemented at 2 separate healthcare locations, and they should be implemented for 2 different use cases that use the same underlying technology. This intention is to demonstrate how the solution can be reused. And lastly, convene a coalition of key stakeholders, such as clinicians, researchers, technical experts, and patients that will be directly involved in the development and implementation of the demonstration projects. Next slide, please. Awardees will also need to engage standards development organizations, or SDOs, to identify opportunities and practical solutions for the advancement of standards that are necessary to capture, exchange, integrate, and use PGHD in clinical and research settings. And this includes leveraging and testing existing standards for the proposed PGHD technology solution. This engagement can also include balloting and updating implementation guides with information resulting from the demonstration projects. Develop the proposed PGHD technology solution using a standards-based approach that collects and shares PGHD among patients, providers, and researchers. Prepare a final report that includes lessons learned and recommendations that provide experiential insights for others who wish to implement similar types of PGHD technology solutions at their organizations. And lastly, development of at least 1 manuscript that details the demonstration project results and submit to the appropriate journal. Next slide, please. So since health equity is a goal of Area of Interest 2, applicants must demonstrate their proposed technology will support underserved communities, and applicants must also demonstrate expertise in user-centered design, workflow design, data visualization, and cognitive support. Now I'll turn it back over to Wei.
Thank you, Steph. So now we are going to talk a bit more about the LEAP in Health IT program. So LEAP in Health IT seeks to address well-documented and fast-emerging challenges that inhibit the development, use, and/or advancement of well-designed interoperable health IT. Applications submitted under this Notice of Funding Opportunity will be funded under the LEAP in Health IT NOFO, which is NAP-AX-22-001. Aside from areas of interest, required expertise, and deadlines listed in the NOFO, all other requirements, application instructions, and terms and conditions of NOFO NAP AX22001 apply. So this is a competitive funding opportunity open to public or nonprofit private institutions, such as a college, university, or faith-based or community-based organization. Units of local or state government, eligible agencies of the federal government, Indian Native American tribal governments, federally recognized, other than federally recognized, and tribally designated organizations. For-profit organizations may participate in projects as member of a consortia or as a subrecipient only. Because the purpose of this NOFO is to improve healthcare in the United States, foreign institutions may participate in projects as members of a consortia or as a subrecipient only. Applications submitted by for-profit organizations or foreign institutions will not be reviewed. Organizations described in Section 501c4 of the Internal Revenue Code that engage in lobbying activities are not eligible. HHS grant policy requires that the grant recipient perform a substantive role in the conduct of the planned project activity and not merely serve as a conduit of funds to another party or parties. In consortium or contractual activities represent a significant portion of the overall project, the applicant shall justify why the applicant organization, rather than the party performing this portion of the overall project, should be the recipient and what substantive role the applicant organization will play. Applicant organizations may submit more than one applications, provided that each application is scientifically distinct. So project activities will include define a project plan that will include all key objectives. Document and report progress throughout the project timeframe. Utilize research methods to inform the demonstration projects. Publish and disseminate project findings in a way that translates project outcomes into usable knowledge and insights for federal partners, health IT industry, SDOs, CBOs, developers, healthcare systems, and providers to maximize the accessibility of this knowledge to the entire health IT community. Select measurable outcomes that are specific to the project's area of interest and key objectives. Conduct virtual midpoint demonstrations and provide an update regarding any proposed approaches, prototypes, and/or revisions to the project plan to illustrate their progress on the area of interest. Now we will talk more about the funding, eligibility, and application information. So here is a summary of key details that you will want to know for submitting an application under LEAP in Health IT Notice of Funding Opportunity. So this is a cooperative agreement, and the available funding is up to $2 million with a total of 2 awards, which is up to $1 million per award. And the application due date is August 15th, 2022, with the anticipated award date of September 26, 2022. The anticipated start date is also September 26, 2022. And the performance period, as mentioned, is 2 years with a total of 2 awards, 1 award per area of interest of up to $1 million. So the letter of intent, applicants are strongly encouraged to submit a non-binding email letter of intent to apply for this funding opportunity. The letter of intent must be submitted by June 30th, 2022 by 11:59 p.m. Eastern Time. We ask that you send a letter of intent to onc-leap@hhs.gov and with the title of LEAP Fiscal Year 2022 NOFO and identifying the area of interest 1 or 2, the name of the applicant organization, the city and state of the applicant organization, as well as indicating the NOFO number listed here. So the applicant must submit all materials electronically through grants.gov, and this process is outlined in detail in the Notice of Funding Opportunity. For assistance with submitting applications on grants.gov, please contact the grants.gov help desk at support@grants.gov or call at 1-800-518-4726. You must also have a Unique Entity Identifier or UEI. UEI can be obtained via registering at http://fedgov.dmb.com/webformsam.gov and typically takes 7 to 10 business days. So please plan accordingly. You must also register in the System for Award Management, or SAM, at www.sam.gov and use your UEI there. The same registration process can also take 7 to 10 business days, so please plan accordingly here as well. If you have already registered with the SAM, but have not renewed your registration in the last 12 months, you will need to renew your registration. You will also want to make sure that your application meets the application requirements and page limits outlined in the NOFO. So what are the application components? First is the project abstract, which has a limit of less than 500 words. Then the project narrative, which is limited to 35 pages. And then we'll also need the Form SF-424, which is the application for federal assistance. Form SF-424A, which is budget information for non-construction programs. Form SF-424B, which is assurances for non-construction programs. Form SF-LLL, which is the disclosure of lobbying activities, a budget narrative, as well as the letter of commitment. So the project abstract represents a high-level summary of the project that can be understood without reference to other parts of the application. And that provides a description of the proposed project, including the project's goals, objectives, overall approach, anticipated outcomes, products, and duration. The format is no more than 500 words and includes the project title, applicant name, physical address, contact name, contact phone numbers, email address, as well as the website address if applicable. The project narrative should address the elements articulated in the areas of interest section of this NOFO. It should also align with the performance goals and objectives, as well as the merit review criteria presented in this NOFO. Applications that do not follow the outlined format must be reviewed by an ONC designated official. The format for the project narrative is double-spaced and no more than 35 pages. We ask that the project narrative be formatted to letter size plain white pages using either Cambria or Times New Roman font with a 1-inch or larger margins and font size 11 or greater. Your project narrative should include the following components. These components will be counted as part of the page limit. The suggested length of the components, which are given below, are guidelines to help applicants create a balanced document, and they are not mandatory restrictions. First part will be understanding of the project purpose, which is roughly 2 to 3 pages. Then it's the proposed approach and activities, roughly 10 to 14 pages, and applicant capabilities, roughly 9 to 15 pages, then budget narrative, which is roughly 2 to 3 pages. So understanding of project purpose. This section should offer the applicants conceptualization of the selected area of interest. This should include, from the applicant's perspective, a specific delineation of the objectives and research challenges the proposed project will address, specifically distinguishing between challenges that can be addressed in the self-contained project period of 2 years and challenges requiring a longer period, 3 to 5 years. Applicants shall clearly state which area of interest the proposed project will address. In the proposed approach and activities section, the applicant should provide a clear and concise description of the approach the applicant is proposing to use to conduct the research and development work, including identifying the major challenges and proposed activities used in the approach. It should be organized so that each element of the project plan is clear and aligns to the project's key objectives and project goals. The applicant should include the usage of novel concepts, approaches, methodologies, tools, and/or technologies, and provide insight as to how their usage will inform the field of health IT. The approach should also include proposed strategies on how the results of the project may be disseminated and transitioned to field at large. The approach should include as much details as possible given the page limitation. The plan for each activity at a minimum shall state specific aims, the previous work of the investigative team on which the proposed research is directly based on, the proposed or the methods that will be applied, the anticipated outcomes of the work, and their potential significance in addressing the challenges of the selected area of interest, as well as the key personnel who will be involved. In the applicant capabilities section, the applicant should describe the project team, the personnel qualifications, and past performance demonstrating experience consistent with successfully meeting the goals of the cooperative agreement. It is recommended that the project team be comprised of the following roles: project director or principal investigator, At least one person on the proposed team shall possess health IT experience. For both Area of Interest 1 and Area of Interest 2, the proposed research team must have expertise in the areas outlined in the NOFO. Section 3A, which is a plan for disseminating and transitioning appropriate research results into practice. So this section should include a plan for engaging industry stakeholders to adopt, disseminate, and transition findings from the project into data standards, data infrastructures, health IT products, tools, and best practices. Collaborative arrangement with industry and other groups outside of an applicant institution should be accompanied by appropriate letters of support. In the event an applicant's solution include the development of a prototype, the applicant should also submit a plan for approval by ONC, illustrating how the prototype will be made and maintained in a publicly available and acceptable domain at no cost to the general public. In the Stakeholder Coordination section, the applicant should describe plans to establish and operate a technical expert panel of relevant and appropriate stakeholders, including names of members who have committed to join or proposed to join to help inform the work to be conducted on the relevant area of interest. In the project management section, the applicant should include a clear delineation of the roles and responsibilities of the principal investigator, participating researchers, project staff, consultants, and collaborating organizations, and how they will contribute to achieving the research objectives and outcomes. If the application includes subcontractors, plans for coordinating activities across multiple organizations should be described. This section should specify who would have day-to-day responsibilities for key tasks such as leadership of project, monitoring the project's ongoing progress, preparation of reports, and communications with other collaborating organizations and ONC. Recipients will be required to maintain information relevant to executing the proposed project plan and performance-based outcomes. The application should also describe the approach that will be used to assess project performance and monitor and track progress toward meeting key objectives. The application should include a detailed project timeline as an appendix that incorporates those objectives, as well as an organizational chart as an appendix that reflects roles and responsibilities. In the organizational capability statement, the applicant should describe the organization's capabilities, qualifications, and approach to address the work to be completed. The statement should highlight potential strategies the organization may employ in an effort to sustain research efforts beyond the scope of the project timeframe, and include any relevant organization resources available to perform the proposed project. This may include facilities, equipment, and other resources. Applicants who are working with project counterparts as part of a consortia shall also provide letters of commitment from them. The letters of commitment shall be included with the appendices and will not count toward the 35-page limit. In the budget narrative section, The applicant should include a detailed breakdown of how the applicant plans to use or spend the allowed resources to complete the activities detailed in the NOFO. The budget narrative on how the proposed budget, as articulated in the SF 424A, aligns with the applicant's project narrative. The application for federal assistance, which is Form SF 424. The budget information for non-construction programs, which is Form SF 424A. Assurances for non-construction programs, which is Form SF 424B, and the disclosure of lobbying activities, which is Form SF LLL, as well as the detailed budget instructions are provided in the NOFO. So now we will talk more about the application responsiveness and merit review criteria. So all applications materials should be submitted electronically through grants.gov. Grants.gov issues an email receipt upon successful submission of the application. Applications are reviewed for responsiveness and categorized as pass or fail. All applications that pass the review for responsiveness are forwarded for merit review. Once the merit review is complete, ONC may make an award. ONC is not obligated to make an award if none of the applications meet the intent of the program requirements or if there is a change in funding levels or availability of funds. All applicants must meet the following completeness criteria or they will be administratively eliminated and not sent forward for merit review. The applicant must meet the eligibility criteria. The application will need to be received by the deadline of Monday, August 15th, 2022 at noon Eastern through grants.gov. The application contains all required components, which includes program narrative, SF424, etc., that are listed in the Notice of Funding Opportunity. The application meets all formatting and length requirements. The appendices and attachments are not used as a mechanism to exceed page limits of the project narrative. So the merit review criteria. Responsive applications are forwarded for merit review, and the merit review will be conducted by a review panel of at least 3 experts in the field from academic institutions, nonprofits, and local and federal government agencies. Application can receive a maximum of 100 points using the following scale. Understanding of project purpose, which is worth 10 points, proposed approach and activities, which is worth 40 points, applicant capabilities, 30 points, and budget narrative, 20 points. So understanding of project purpose, which is 10 points, includes the following. The extent to which the application addresses the objectives and the project goals of this NOFO. The extent to which the application identifies a project plan and activities that align with one of the 2 identified areas of interest within the NOFO. The extent to which the application identifies barriers and ways to mitigate those barriers with one of the 2 identified areas of interest within the NOFO. The extent to which the applicant describes how the project expected outcomes and results will inform future health IT development, research, and implementation. Approach and activities, which is 40 points, will include the extent to which the approach, design, methods, and analyses are specifically stated, adequately developed, well integrated, well reasoned, and appropriate to the project goals and key objectives of the areas of interest, which is 20 points. The extent to which the applicant proposes a clear and detailed plan for disseminating and transitioning appropriate research results into practice. This section of the application should include a plan for engaging industry stakeholders to adopt, disseminate, and transition findings from the project to stakeholders who will continue to advance the work. 15 points. And finally, the extent to which the plan describes a project management approach for ensuring project success should be 5 points. In terms of applicant capabilities, this section is worth 30 points and includes the extent to which the applicant identifies all the resources necessary to perform the proposed work and outline strategies to complete this work within a 2-year time frame. This is 5 points. The extent to which the scientific environment in which the work will be done contributes to the probability of success, employs useful collaborative arrangements, and has evidence of institutional support. 5 points. The extent to which the project proposal integrates and provides an appropriate level of research and technical knowledge and subject matter expertise. 20 points. Now, the budget narrative section will be worth 20 points total. It includes the following. Does the application provide the proposed level of effort of the project team and consultants, and describe how they're adequate and appropriate to advance the project in accordance with the project plan? Does the application include an explanation of how the proposed budget supports the project and is cost efficient and reasonable for meeting the project activities? Now I will turn it over to the grants team.
Thank you, Wei. Regarding questions, all questions must be submitted in writing, either Q&As. Thank you for attending. We will remain online for 5 minutes. Submit any remaining questions via the chat on this webinar. To see the NOFO on grants.gov or to apply, go to the link on the screen. For assistance with submitting applications in grants.gov, please contact the grants.gov help desk at support@grants.gov or call 800-518-4726. Please submit your questions. We have 5 minutes remaining in this information session. 3 minutes remaining to submit your questions. One minute remaining. Please submit your questions. LEAP NOFO FY 2022 dates to remember. The release date is June 14th, 2022. Informational session, June 28th. The letter of intent is due June 30th. The application deadline is August 15th, 2022. And the anticipated award date is September 26th. Thank you for attending. The moderator will now end this session.